Can you hear me?
Hi, Dr. Osorio. I can hear you. How are you?
Good.
Can you hear me?
Let's see. Hold on just a minute. All
Okay.
right.
Yeah.
Cutting out a little bit.
Yeah.
Hello?
Hi. Is it not okay?
Hi.
Is it
Yeah, yeah, but it was freezing. Yeah, it was freezing.
okay?
Hello?
Maybe let's let it warm up a little bit. Let
Okay.
me know when we're okay here.
All right.
You guys are closed for the day? For you guys are
Yeah,
closed
we
today?
only work 4 days a week.
Okay. But you do
Yeah.
admin work on a Friday typically?
Nope. Play guitar and have fun.
You're hanging out. I like that. That's
Yeah.
great.
Now I'm here at my house, so no, I don't do anything. I just have fun.
Oh, I love it. Okay, good. It's been a while since we actually spoke. I know that you've been more in communication with Charlie and
Right.
the rest of the team. But yeah, I mean, I have questions for you. We don't have to make this super formal, just a little
Yeah.
bit back and forth banter.
Sure. Sure.
Um, but I guess we'll start off with communication,
hmm
right? I know that you have Charlie as your account manager. How have you
hmm
been feeling with your relationship with him and how he's been handling your transactions and your account? I do want to know about that.
Yeah, he's an awesome guy. I love him. He's very every time I call him, he calls me back when he said he's going to, and he's just very willing to help all the time. So I really appreciate him. Yeah, he's a great guy. I enjoy his customer service. Yeah.
That's really good to hear. You know
Same
that.
with you too. You have been, but at the beginning you were very helpful too. So got to
Thank
give you credit too.
you. And I'm really glad to hear that. You know that our team is an extension of who we are. And
Mhm.
because we can't be in multiple places at once, that makes me feel so good that we put the person in the right place to handle these accounts. So thank you so much.
No
Um,
problem.
Okay. And then I guess just if people tune in and watch this, maybe you could just tell us who you are, a little bit about your practice, and then yeah.
Sure. My name is Jamie Osorio. I practice in Dallas, Texas. I have a cosmetic mini implant practice mainly, but I do bread and butter dentistry as well. Been doing it for actually going to be 20 years in May. We're going to celebrate our 20th anniversary in May. So,
Wow. Okay.
um,
Good stuff.
yeah.
Okay. And I guess to get into the marketing portion of it,
Mhm.
we've been working together for, oh man, I think only about five, 6 months now. But what
Mhm.
was your past marketing like before we started working together?
Well, it's just a lot of frustration because a lot of them did the Facebook thing as you guys do, but they promised the world. Um, they would say, well, we if the patient shows up but they don't do any work, we're still going to charge you, I don't know, $40 a patient, even if they don't do any work. So it got to be where they were making more off of us than we were making off them. And so I just kept switching and switching, and they were all the same. A lot of them try to keep you in contracts too, like 6 months to a year. That's what I really liked about you guys because y'all, say, hey, we go month to month. We don't have anything to hide. If you don't like us, just give us 30-day notice. I appreciated that. Same thing with how I feel in my practice. I think if you're really gonna, do something or you say you're gonna do something, the results will show if you do or not. So I feel like you guys didn't try to hold me to a long contract, and you proved yourself to me. So very appreciative of that.
Awesome. Yeah, going back to that commitment, we don't want our dentists or our clients to feel tied in. We want
Mhm.
you guys to be happy, and that's really the thing. We don't want to tie you in if you're not happy with the results.
Right.
It's a two-way street, so that's really good
hmm
feedback for us. Um, what were what are the bottlenecks? What were the problems you were having with marketing? Like, what was the quality of the patients that were coming in previously before we started up together?
Well, they weren't very good. Like I said, they promised that they were going to verify, their credit score, if they're interested in many implants or whatever. And these patients wouldn't even be talked to. They would come with no expectation of paying anything. I don't have any money. I'm just here basically to waste your time. mean, that's what I felt the bottleneck was that nobody was talked to. And I understand, our my staff has a responsibility to follow up, confirm and all that. I get that it's not just up to the marketing team. It's a team effort. But the things that were promising and just wasting our time and then charging us for patients showing up. That's
Yeah.
the thing I didn't get. I mean, so I don't know. It was very frustrating there for almost a year and a half until I found you guys, and you actually, what I was envisioning in my mind about how, have a call center, have an introduction before they come to the office to see if they're even interested or whatever. And let we're not expecting for you guys to do all the work, but some kind of introduction or, description of what their needs are or something of how we can help them. And I think you guys did that for us. And that was the turning point. I mean, I was like, finally, something I was envisioning for 2 years ago is now happening, so I was very, very pleased with that. So just put it
Yeah.
out in the universe and it came back to me, but it took a while. I just be patient. I'm not very patient sometimes, but worked out
Yeah.
this time.
I think like what you were envisioning was something we were too. And it just takes a lot of innovation. And like
Mhm.
you said, you have this idea, but how do you put all the parts together, have the right people in place to make the phone calls, to conduct, virtual consultation and
Mhm.
pre-approvals and stuff. So patience, I think it paid off. But what is the result now? What is the quality of the patients that you're seeing now that we're bringing to you?
Well, a lot of them are already ready to do work. As soon as they come in, they go, yeah, they talk to me about my credit score. I'm not sure if it's going to go through, but I've already talked to my mother or my father-in-law. They're going to co-sign for me. So it's almost like a warm call or warm appointment where they're already know they have to, pay something and they're ready to go. And it may not be, a big home run, but sometimes it's, 4 or 5 thousand instead of 16, it's 16,000, it's 4,000, but all that adds up after a while. So
Absolutely.
that's the difference.
And Dr. Sorio, I know that you guys primarily do mini implants. I'm just
Mm-hmm.
going to throw this question in. I think with that,
Mm-hmm.
you guys have been able to price yourselves at a very competitive like level.
Mm-hmm.
I'm going to throw this question in, Dr. Osorio, but
Mm-hmm.
how do you feel this plays a role in, you know, patient acceptance and things like that? Because I know, because your price point is so competitive and,
Mm-hmm.
the price point with a combination of them liking you and your office, it's almost a home run. But
Mm-hmm.
how big of a part does that play in patient acceptance for you?
Well, I talk to them about tradition, and I give them a choice because I never want to talk down on traditional implants, the all on fours that, around 35, 40, 50,000. But I make it a point to go, that's a great service if you can afford it. But, if you can't, we have something plan B over here that's within price range. And I try to talk to them about not 16,500 for your whole mouth, but I try to talk to them, you know, financing, it's only $343 a month. So I
Mhm.
talked to them about that aspect, like what can you do for a monthly payment?
Yeah.
And that tends to be, oh, okay, well, that's more affordable because I just came back from another consultation and they're charging me $40,000 and I can't afford that. So that's the reason I've set that price point because I want to be competitive and go, hey, if you can't afford this 40,000, we've got something. We don't have to do bone grafting. We don't have to do that. We can still get you the same thing, similar thing at a better price that you can afford instead of just having traditional dentures where they have bone loss and they have to use glue and all that. So it's a very good second option.
Yeah, and you're giving them options. That's the thing.
Mhm.
I think that what you're doing is once they walk through that door, you're giving them clear cut options and you're
Mhm.
not, and they know what their options are, so they're not walking away without knowing what they want, right?
Right.
And I think that's super important.
Another thing too with if I see their periodontal health is good,
Yeah.
I don't say let's pull your teeth and just do implants. I'll say, hey, we can do either individual implants. They'll be a little more expensive doing, just an implant and a crown, implant and crown. Of course, that's always more expensive. But I also say, hey, we can do roundhouse bridges that are permanent We just have to shave your teeth like a veneer almost to cement everything. It doesn't come out. It looks cosmetically amazing. And we don't have to pull your teeth because your teeth are still in good shape. So really the ones I reserve the mini implants for are the ones that have bone loss, loose teeth,
Mm.
bad periodontal health. Those are the ones. But so I always have a 1, 2, 3 option,
Yeah.
and it's not always just mini dental implants. So just because we do advertise for minis, they can turn into something else. And sometimes they pick partials too, which I don't,
Hmm.
those are a service. They're not the best thing, but end up we still get good sales from that. And two partials can be with extractions could be in the $5,000 range. If you think about that, with plastic surgery, that's a nose job or another surgery. I don't want to say right now, but it's
Yeah.
it's a good service, even if you're not doing the high home run type of services. You
Yeah,
still
it adds up.
sell it.
It's money
Yeah,
on the table that we
yeah,
don't need that money to walk away right now.
right.
Okay. Amazing.
So yeah.
And then when it comes to financing,
Hmm.
like, so I know you guys work with a handful of third-party lenders and things like
Hmm.
that. You typically do, most of your patients do opt for third-party financing. Is that kind of what that
Yes,
looks like at the
that's
office?
great. And there's a very few that will say like, it's here, it's going to be 14,500 for you. They're like, what if I pay cash?
Yeah.
It's, all right, I'll do it for 12, but you got to pay all of it today, or
Yes.
something like that.
Right.
So, but the majority of it, yes, third party financing is how we do it.
Okay. Yeah. And I wanted to ask you that question because sometimes I'll speak to a dentist and
Mm-hmm.
they're like, oh, I work with care credit. It's like,
Mm-hmm.
for me, I believe that, like you said, just like how you give your patient options with treatment, you do need to give them payment options as well.
Exactly. Yeah, we have Care Credit Lending Club. Um, what's that? Sunbit. I don't know if you've heard of Sunbit.
Hmm.
Um, there's another one, medical, but we don't use it that much. Those are our main three ones, and
Okay.
we're always open to more. If you know of any more,
Yeah.
please send them our way because there it's just having one is not enough. Like you're saying, you have to give them choices.
Yeah. Yeah.
Yeah.
And I think because like I talk to so many lenders
Mm-hmm.
who are coming up with new products and services,
Mm-hmm.
but they'll never tell us what the underwriting process looks like. So meaning like we don't know if they're going to base it off credit score or debt ratio,
Mm-hmm.
annual salary. So having those options and putting them through kind of the ringer, if that patient allows us to put them through those lenders,
Mm-hmm.
they could come out with a pre-approval for 12,000 at one, 20,000 or 5,000
Mm-hmm.
at the
Mm-hmm.
other. So I
Right.
think that being almost creative for our patients is going to help them get what they want also.
And I even like sometimes if they'll let's say, oh, I gotta work on my kitchen though for these next 2 months. I'll do it. I'll do it in June or something. I had one the other day, and I always let my girls, after they go in there and try, to try to get them to sign off on everything. I'll say, hey, if they say no, come and get me. Come and go to my office and come and get me because I'm going to offer them something different or see if I can. I'm not going to give up. So I
Mm.
go in there and I go, hey, listen, I understand you have to fix your bathroom, but let me make the first 2 payments for you. You won't have a payment until June. So you can get your stuff done. Not have to worry about a payment. Just bring your payment in here. I'll write a check, send it off on time. And then, so what I'm thinking is I'd rather have something than nothing.
Yeah.
I'd rather have something now than wait. Because the longer you wait on the patient, the more they're going to go, I changed my mind. I'd
Mm.
rather have something right now, even if
Time
it's a
kills
little
all
less.
deals.
Yes, exactly. So just,
Yeah, I love that. I love that. I think, going back to people always wanting to hit those home runs, when you
mhm.
wait and you wait and wait, sometimes it time kills all deals and it doesn't happen.
Yes, it
Yeah.
does.
Okay. Any on the clinical portion of this,
Mhm.
any other words or advice or tips you can give any dentists that are doing marketing but maybe just need things that have worked for you maybe that maybe you could pass on to them.
Well, definitely do your due diligence, but uh, your company allows. I mean, everything that I envisioned that I wanted to happen happened with your company. So, um, definitely I would not advise on long-term contracts if you can avoid that, just because, I feel like if a company's going to stand behind their product, they're gonna say, we can go month to month. That's fine because we know our service is going to work. And then I would just say, don't give up. I mean, if until you find something that fits you, just keep trying because um, you'll find it eventually. Because I did with you guys. So,
Thank you. Can I speak to that though, not giving up?
mm-hmm,
Um, because I do speak to a lot of dentists who tell me they can't make the commitment. They've been burned. They're just so
mm-hmm,
over it just because they're tired of wasting money. But
mm-hmm.
I just feel like if you own a business, it doesn't matter if you're a dentist or whatever that may be, if you're not doing any marketing, well, then what are we doing? Right?
Yeah,
What are we
exactly.
really doing here? So
Yeah.
maybe just, I guess my last question for you is for those who feel like they're tired and have just feel like they don't know which direction to go with marketing,
Mm-hmm.
any words of, advice that you could give those people in that situation, maybe?
Keep going. I mean, you need to spend to make. I mean, that's just the bottom line. I mean, whether it's successful or not, I mean, the dentists themselves have to gauge, do I want to give this 3 months, 4 months? But if you're starting a marketing campaign, you've got to give it some time. You can't just go on a month and go, oh, well, this isn't working the first month. You've got to let it at least 3 to 4 months, try it out. Now, if you lose money, that's part of the business, and you get to write it off. Get to
Mm-hmm.
write it off. So it's not a complete loss. So the more you spend, the more you write off, and you got to take risks. I mean, that's part of being a business. If you want to be an employee, be an employee with no risks. But if you want to be a business person, you have to take risks. And sometimes you lose, sometimes you win, sometimes you lose, but you keep going, you're going to find it.
I think that's a good reminder. We just got to
Yeah.
take those risks. We can calculate them a little bit, but we got to take those risks.
Yes. Yes.
Um, and then before one thing here, Dr. Osorio, I'm just going over your numbers here.
Mm-hmm.
You can correct me if I'm wrong, if you have something different.
Mm-hmm.
But in your pipeline for cases accepted and
Mm-hmm.
patients that have started treatment, I have
Mm-hmm.
a number of 83,500. Is that pretty close to
Yeah. Let me look. Charlie
uh,
sent me
report?
my ROI.
Okay.
Yes, that's correct.
Okay.
That's
How,
correct.
how are you feeling about those numbers? Do you feel obviously there's always room for improvement, but how
Yeah,
do you
and then
feel?
again, that's I'm not, putting that all on y'all. That's goes with us as well. Follow-ups, and it's a team effort. But no, I'm very happy with the results because before I wasn't even, I was maybe breaking even on a couple of them. I think I did 7 or 8 different marketing campaigns for almost a year and a half to 2 years.
Mm,
And I think I broke even twice on with those other ones. But with you guys, of course, you can see the results with the great ROI that you guys have provided for
mm,
our team and for our practice.
mm.
So
Well, thank you. I appreciate it. It makes me feel good. It's a good reminder for me as to why I'm doing this and why we're here.
yeah.
These testimonials are just proof to that. So that's why I did want to capture this on video because it feels amazing. So I'm so happy that you're happy with our services, Dr. Osorio. And but I think yeah, that's it for today. So
Okay.
thank you so much.
You're welcome.
Um, you know where to reach me if you need me, and Charlie's your main man there as well.
Yeah. All
So,
right. Appreciate it.
all right. Have a great weekend, Dr.
You
Osorio.
too.
Take
Thank
care.
you. All
Bye-bye.
right. Bye.